I'm Dr. Richard Neel. I'm board certified in aerospace medicine. I have a master's degree in public health from Harvard. I had a 20-year plus career in the military, of which culminated in my working for the Pentagon as the chief of medical force protection for the headquarters Air Force security forces. And in that capacity, one of my jobs was to look for countermeasures for bioweapons, chemical weapons, radiological weapons. And in my research, I discovered that, number one, melatonin actually worked for all three, and that it was a totally amazing compound. So there's been a lot more research since that time. And for me, when the COVID came along, it was just a logical choice to use the melatonin because I'd actually made that decision 20 years ago. So, and why melatonin? If for those that didn't attend our last teleconference there, where we had some rather brilliant professors, Dr. Ryder, Dr. Brown, discussing why melatonin would work so well. Let me just say that truly melatonin, I think, is one of the safest molecules in the universe. There is no established LD50 in mammals. And the reason for that is that they've never been able to overdose any of the animals on melatonin in studies. There's melatonin, unlike every other hormone in the body, doesn't have a feedback inhibition loop, primarily because having extra melatonin is not going to hurt you. Since everybody has melatonin in their body, it's been tested against every known drug out there. And so therefore it can be used with any other drug, any other treatment that you've got ongoing with the patient. And of course, lastly, it is cheap and readily available without a prescription. So again, just how safe is it? The study from the Journal of the Pineal Research, I realized, again, we were just, as Corey mentioned there, or Dr. Pupko mentioned, that it's really hard to, there's so much research out there now, it's hard to read it all. And I realized the Journal of Pineal Research is probably read by clinicians just north of the proverbial Scandinavian journal of stool velocity there. But the Journal of Pineal Research has a wealth of information about the safety and efficacy of melatonin, just others. This is one particular study where they used high-dose melatonin in liver resections. Note they gave the patients 50 milligrams per kilogram. We're talking 3,000 to 4,000 milligrams of melatonin in single doses preoperatively. And actually, the patients who received the melatonin did better postoperatively than the control group, with no adverse events. There's wealth of other studies. Another great study where they gave 1,400 women 75 milligrams of melatonin every night for 40 years, and they all tolerated it fine. Just to test to its safety there. Then effectiveness, gosh, you know, since even I was ready to use it for chemical and biological agents, melatonin is recommended for use with SARS, MERS, West Nile virus, Venezuelan equine encephalitis. I mean, they actually used it for Ebola. It's useful not just against viruses, but bacterials as well. Sepsis, the fact that melatonin is not used for more things is just a travesty to me. One of the first studies that actually got my attention back in when I was looking for antitoxins and antiviral things was a study on neonatal infants where they were given septic neonatal infants. We're talking 3 to 5 pound babies that are super sick, and they were giving them 10 milligrams of melatonin IV twice a day. Every baby they gave the melatonin to lived. The babies that didn't get the melatonin had a 30 to 70% mortality rate. Now, if 3 to 5 pound babies can handle 10 milligrams of melatonin IV twice a day, I think adults can certainly handle a lot more. Couple of clinical studies. That's the real problem. There really needs to be more studies. One high dose study, that was a preliminary study in Manila. They gave the patients 3672 milligrams a day in 4 divided doses. None of those patients required intubation. All those patients did well. Their average number of days in the hospital was only 8.6 compared to 13 days for the non-treated patients. There was another low dose study in Tehran, of all places. That was a randomized double-blind study. They gave them whole 3 milligrams 3 times a day. Again, everything that they measured in the patients that received the melatonin, all their clinical measurements improved. And again, their mean time to discharge was shorter, and both of them were statistically significant in their analysis. So we're left with a lot of anecdotal experience. I myself have, my staff, we've treated well over 2,000 patients now with melatonin successfully. I've gotten a lot of good feedback from other providers since our last teleconference that have used it. I get a lot of patients that tell me how they've treated their friends and families and neighbors as well, just because it's readily available. Many of the patients we treated have said significant co-morbidities. I was going to put there are a lot of stories available, and there's a very brilliant reporter there at the Divine News who has chronicled a lot of our patients who have been willing to tell their stories of how they did in their families with the melatonin. Adley, I'd like to add that it was part of the treatment for the president when he had COVID. I'd like to think it was probably the most important part of his treatment, but I can't prove that there. So this is one particular case. The message on the left you see is pretty typical. I got a call from someone that somebody gave them my number, and what she doesn't say there, when I found out later, that their mother was already on 100% oxygen. The only reason they hadn't intubated her was because she was a DNR. They had told the family to gather because they didn't think she was going to live much longer. The family called me. They started her on melatonin, 60 milligrams TID. She went home 7 days later without oxygen. This is Mary. Mary's 94-year-old diabetic, hypertensive, and she and her caretaker woke up with COVID on the same day with a high fever, cough, body aches, and thing. They went to the ER. Her oxygen sats were 92. On her x-ray, she already showed some pneumonia, so they sent her off to the hospital. She received 60 milligrams melatonin sublingual in the ER, another 60 milligrams at bedtime. She never ran any more fever. She never needed supplemental oxygen. All she received in the hospital were some IV antibiotics. And she went home in really less than 36 hours. And only symptom, residual symptom was a little bit of cough for a couple of days. So this is our basic dosing schedule for adults. You see, I'm using roughly 1 milligram per kilogram per day in either a single bedtime dose, but most people prefer to divide it up during the day and at bedtime. I found people that only do the single bedtime dose, sometimes in the late afternoon, are starting to have some symptoms recur. So I've given, when I say the highest dose I've given to people has been 240 milligrams a day. Children, I've treated children of all ages. I've actually gone down on my recommendations on doses on children only because they have needed extremely little, and most of them 1 or 2 doses and they're not having any symptoms anymore. They can certainly have a whole lot more if they need it. I truly think that if this was used early in some of the post-COVID inflammatory syndromes that have been out there, that I would love to see it used against that, and I think it would really make a difference. So prevention, I originally was not particularly, I'd say, enthused about using melatonin as a prevention, but it turns out that in use, that certainly with the Cleveland Clinic study that was in our last teleconference, that people taking melatonin daily basis had a 28% overall lower incidence of actually testing positive for the virus. Personally, one significant case, I had a farmer who had a bunkhouse full of migrant workers, and about 8 of those migrant workers came down with the COVID, and we immediately started them on 100 milligrams per day, but we gave all the other migrant workers in the bunkhouse 40 milligrams per night, and not a single one of the other 52 workers ever developed any symptoms. And so I have since been using that 40 milligrams dose for a lot of people who have another family member who is positive, or living with somebody that has the COVID, and it's worked really well as far as them not ever developing symptoms or getting the virus. Thirdly, I just wanted to throw in here, because initially I was using a lot of vitamin D at the same time with the melatonin. I think studies out of Italy and other places have shown that the vitamin D is really important pre-exposure, probably not that effective post-exposure or once you have the virus. So big study out of Italy, almost 800 patients, showed that people with the vitamin D level below 17 had 100% mortality rate. Vitamin D levels from 18 to the 50s basically had a gradual, the higher the level, the fewer the symptoms. And then patients with levels over 60 are the ones that had the fewest symptoms and got over the virus the fastest. So, additional facts about melatonin. Learned a lot about melatonin. Talking about research papers, people are constantly sending me articles on melatonin now. I've learned a lot about bats since this has started, and turns out, bats don't really get a lot of these viral illnesses. And the reason they survive the coronavirus probably is that they have high levels of melatonin since they live in the dark all the time. So certainly the elderly, like all the other hormones in the body, melatonin decreases with age. We've been extremely successful treating elderly nursing home patients with melatonin and not having any deaths in those that were treated. There's so much misinformation about melatonin out there. In fact, most doctors only know melatonin as this little sleep aid that's made in the pineal gland and helps with sleep. But the fact is, most of the melatonin is not made in the pineal gland. 95% of the melatonin in the body is actually produced in all the other cells in the body, where it's doing all its work as a antitoxin, antioxidant, immune modulator. Melatonin is 10 times stronger antioxidant than vitamin C. Melatonin is an excellent radioprotective agent. It's actually one of the few antioxidants that gets into the nucleus of the cell, and that's extremely important. That's why it protects against radiation. That's why you have a lot of melatonin in your retina. That's why women have a lot of melatonin in their ovaries, where it keeps those eggs fresh for 40 years, among other things. Melatonin has been shown to bind the toxins specifically from COVID-19. And in fact, if you look in the research, it's hard to find something that melatonin doesn't help with. One interesting thing, I had a patient post-COVID with a bad pancreatitis. I Googled up melatonin and pancreatitis. Turns out melatonin is very helpful with acute pancreatitis. And in fact, this gentleman responded really well when he was given the melatonin. This is just a little plug if you want something for your patients. Dr. Richard Hansler, he's actually, I think, 95 years old now. He wrote this book last year, sent me a copy. It's an amazing book. Dr. Hansler has worked with lights all his life and recognized that in part of that melatonin, which is very affected with the lights normally, but he was early to recognize that melatonin actually did help fight the COVID-19, and I was very impressed with it. So why melatonin? It works. It can't get much better safety profile. It's cheap. Everybody can have access to it, even though in some of the other countries, I've treated people actually all over the world. A lot of the other countries, melatonin is actually a prescription. So, so why is it used more? You tell me. I can get on my soapbox.
All right. Well, maybe we can ask the audience.